Today in Focus, a woman in Cameroon died because the local hospital didn't have a standard electrocardiogram machine or supplies to treat her for dehydration. Her son, who lives in Boston, was upset that the hospital was giving the people of Cameroon false hope. So he's now working to make sure that no other patient is denied proper medical treatment there, and he's teamed up with the American Medical Resources Foundation to make that happen. Tata Agwo and Victor Solagayastoa both join us here today to talk about this afternoon. Hello to you both.
Hello.
And good to have you here. Tata, it was your mother who died, and that has made you want to make a difference. How?
Yeah, my mother died on September the 17th, 2005, and when I got to the hospital, then I discovered that she died from complications of dehydration. And I went to the ward where she died. There were many patients dying and children, and that got me really carried away. And I thought making a difference in the name of my mother and helping that community would be the best way.
And you work in Boston and are familiar with the hospital systems here?
That's correct. I work at Beth Israel Deaconess Medical Center.
How are you going to do this?
Well, Leslie, thank you. When I came here, I contacted the CEO of Beth Israel, Paul Levy, and I asked for help. He put me in contact with Jane Madlaw, who is the Director of Community Services, and they gave me numbers which I called, and I hooked up with the American Medical Resources Foundation. So what I've been doing is pleading for help from the public, and also volunteers from staff from Harvard Medical International have also been assisting me to put a strategic program in place, and that is pretty much, I think after this we are writing a grant proposal which will also help, and we are pleading for the public to assist us to ship the equipment that we already have to Cameroon.
All right, you have teamed up with the American Medical Resources Foundation. Like you said, Victor Solagayastoa, you created this organization. It's a nonprofit, and what does it do exactly?
Well, we provide functional medical equipment to whoever requests it. You know, obviously our mission is to provide this equipment, put it on the hands of people that provide health care to the poor. That's our mission, and we make sure that the equipment that we provide is functional and ready to be to use in a patient in a local hospital.
Why did you start this?
Well, I'm originally from Guatemala, so I really know about the need that exists in most of all over the world, and that motivated me. I had the opportunity to meet some good people who opened doors and kind of helped me out to get this mission rolling, so to speak.
How much medical equipment is out there that still works, that a state-of-the-art hospital might have just upgraded and doesn't want to use it anymore?
Well, I believe it's a lot of equipment out there that can be utilized in other countries. Usually our technology in this country changes constantly, which that gives an opportunity for them to release some of the old technology that, so to speak, that become to be a perfect technology for a lot of those countries and the developing countries.
We have been looking at some pictures that you sent along, and what are we looking at?
We're looking at my mother, who I last saw in 1998, and we're planning to meet in December of 2005 when she died. And that is, I'm thinking, if we can assist my mother and those who are dying in that hospital, we can save lives. And I'm pleading for help from organizations who can assist us by sending donations to American Medical Resources to ship the equipment. And we're also writing to see if we can get help from organizations that are willing to give us medications for this hospital.
And you wanted to say thank you to some people who have helped you.
I want to thank Amanda Poland, who has devoted her time, extra time to work with me. There's Amanda Poland, there's Albert Gills, and there's Elizabeth Brown, there's Dr. Harvey Macadon, there's Dr. Robert Cron, all who are working to help me. And just to note, we have an education awareness program at Beth Israel Deaconess Medical Center, Sherman Auditorium on April the 14th. And guest speakers will be the president of African Cardiologists, who is flying over, and the president of Cameroon Medical Council, who is also flying over. So they will be there to give additional information about this project and program.
All right, so you need 25,000 and it's going to make a difference.
That's correct.
All right, both of you. Tata Agwo, thank you for being here. Victor Solagaya-Stoa, thank you. You can both go to bed at night knowing that you've made a difference in the world every day. To donate to the American Medical Resources Foundation, be it time, money, or medical equipment, you can call them. The number is 508-580-3301, or you can send a donation to AMRF at P.O. Box 3609, 36 Station Avenue.